Hi, and welcome back to Better You. I'm your host, Cynthia Thompson. I don't know about you, but I have always had trouble keeping my weight down. I am what some people would call a yo-yo dieter. I tend to lose weight in spring and summer and gain it back in the wintertime. But do you know that there are some tools out there that we can use if we want to try to lose weight? We can try the old tried and true diet and exercise. There's also diet pills, but do you know that there are weight loss surgeries also? My guest today is Dr. Lowe, and he is one of the leading weight loss surgeons here in Charlotte, and he's going to explain us the whole process and what all is involved in weight loss surgery. Thank you for joining me today, Dr. Lowe.
Thank you for having me.
So before we even start, Dr. Lowe, tell us just a little bit about yourself.
Okay, I'm originally from Reston, Virginia, right outside of Washington, D.C., and I went to college at University of Virginia, and then did medical school and residency at Emory University, and came here to Charlotte in 2002. And I've been here for the last 11 years.
And who do you work with? What practice?
I'm with Carolina Surgical, and we're a 5-man group here in Charlotte, and we practice out of Presbyterian Hospital as well as CMC Hospital.
So let's just get right to all these questions that I have, because you know, weight loss surgery has been dancing around in the back of my head, but I'm not real sure about it.
Okay.
So why should a person consider weight loss surgery?
Well, a person should consider weight loss surgery if his or her BMI is greater than 35 or 40. That usually corresponds with a weight greater than 100 pounds. What happens is that when someone has that much extra weight, it is very, very difficult for that person to lose that weight without some tool, surgical tool to help.
So I've heard that weight loss surgery can be helpful if you have health issues, and that's why some people choose to do this. Is this true?
It is true. Weight loss surgery is the only known treatment for diabetes. And when I say treatment, most other medications that you take just help blood sugars, but they don't get rid of the diabetes. You still have to take the medication. You're still a diabetic, it's just the medication lowers the blood sugar. Well, weight loss surgery in many people can actually resolve diabetes or put it into remission, where you don't have to take any medication whatsoever and the blood sugars remain normal. And the reason for that, part of the reason is because so much of diabetes is directly related to obesity.
Oh, really?
Yes.
You know, I did not even know that. So if a person has a surgery, they'll be off their diabetes medication?
Well, for a person who has a gastric bypass surgery, 86% of the time, that person can go into complete remission of diabetes. I've seen people who come into the office being on metformin and high doses of insulin and need to take Lantus insulin, 75 units at night, or up to 100 units of insulin a day, and have weight loss surgery, and within a week or 2 weeks can come off of all of that insulin and no longer have to take any diabetic pills or anything else. And they can end having to stick their fingers and check blood sugars, and their hemoglobin A1Cs return back to normal.
So that's a good thing.
Oh, yes, it is.
You know, let's start at the very beginning. If by chance I decide I want to do this, what is the first step?
Well, the first step is to make sure you're a candidate for the surgery. And in order to be a candidate, you have to meet NIH criteria. The National Institutes of Health put out criteria back in 1991 to determine who can qualify for surgery and who shouldn't even consider it. The first step is you have to have a BMI greater than 40.
What is BMI?
That is a body mass index.
And how is that figured?
Okay, good question. A body mass index is a calculated number, and what we're trying to do is figure out whether your weight is appropriate for your height. So for example, say you're 300 pounds, but you're only 5 feet tall. That's too much weight for that height. But say you're 300 pounds, but you're taller than Shaquille O'Neal, that might be appropriate because you're so tall, right? So what a BMI does is it takes your height and it takes your weight and puts it into this calculation and crunches out a number, and we can use that number to figure out whether the weight is appropriate for the height. A healthy BMI is between 18 to 25. Between 25 and 30 people would be considered overweight. And over 30 is considered obese. And once people start getting over 35, that's considered morbidly obese. Anything over 40 automatically qualifies for surgery. Because the weight in and of itself is so dangerous to your health that even if you don't have diabetes or high blood pressure or anything else, just the weight in and of itself would qualify for the surgery. Now, we will also see people who have lower BMIs between 35 and 40, but they have to have some medical condition to go along with that BMI, in that BMI range.
Like what?
Like high blood pressure, or diabetes, or sleep apnea, where people stop breathing at night, or high cholesterol, or severe reflux, something like that.
I'm assuming if I were to come into your office, and I'm still just thinking about this, you would want to see my medical records, and you had mentioned some things that you might want to look at. What are some other things that you look for in a person's medical record?
We want to make sure that they've had the obesity for at least 2 years. Not that this hasn't just been some quick, rapid weight gain, that it's been a sustained problem, and that they have tried other methods to lose weight. We consider this a last resort for people who've tried other methods.
And what are some other things that you look for?
Well, we also want to make sure that a person is going to be committed to following the program. Because sometimes people think this is the easy way out, and they think it's a shortcut, but it really isn't, because these people in many respects have to work harder than those who don't have the surgery.
Oh, really?
They do, because they have to be committed to lifelong follow-up with their doctor, taking vitamins to make sure they don't get malnourished, and committed to exercise programs also, because without exercise and proper eating, the surgeries can fail. So you still have to live right and have a healthy lifestyle to get the most out of the procedure.
Do you look at a person's mental state whenever you consider them for the surgery?
Yes, and we have everyone be evaluated by a psychologist or psychiatrist to make sure that there's no undiagnosed mental problem that would impair their ability to understand what's involved with the surgery or to follow up as they need to afterward.
You know, I've done some research on the internet, which may or may not be a good thing, but I was wondering about the thyroid gland. Where does that fall into deciding whether or not this is a good idea or not for a person to have this surgery?
Well, if a person has an underactive thyroid, that may contribute to some weight gain, but it does not keep a person from having weight loss surgery. So we do sometimes, some insurance companies want us to check a TSH level, which is a measure of how well the thyroid is functioning, just to make sure that the person doesn't have an underactive thyroid before we proceed with surgery.
You know, I think I've asked you quite a few questions. Let's take a short break, and when we come back, we're going to talk more about this, okay?
Okay.
2 outs with a runner on first base. Now the big guy comes up to bat, hitting .342 with 92 RBIs and 36 homers. First pitch, he fouls it, and back to
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
My dad's one of the juices he's there tonight. Bring this sweet.
Welcome back to Betty. I'm your host, Cynthia Thompson. I'm here with Dr. Lowe. We're talking about weight loss surgery. It's becoming very, very popular. We see so many people that are in show business doing this, like Star Jones and Al Roker, and the list goes on and on and on and on and on and on. But I was wondering, when we went on break, is there an age limit as to who can have this surgery?
Well, most surgeons will operate on people who are older than 18 or younger than 60 or 65. There are some surgeons who will do adolescent bariatric surgery, but usually that's confined to university centers where they're doing research, because that type of surgery is still in its infancy, so it's not very common right now for adolescents to have bariatric surgery. Now, once you start getting over age 65, in the upper 60s and 70s, the surgery becomes more and more risky.
Oh, really?
Yes, the risk for complications increase at those higher ages, and for that reason, a lot of surgeons would prefer not to take on that additional risk, because we're in it to make people healthier and better, and we wouldn't want to go in the wrong direction there.
So, Dr. Lowe, let's say I've had the surgery. Do you all offer a weight management program for me if by chance I needed it? Because I'm assuming my diet is going to have to change.
Yes. You are so right. You are so right. Your diet definitely does have to change. Listen, the way I look at this surgery is I look at it like it's a second chance. It's a second chance to do things differently, okay? What I mean by that is that the surgery will usually take off 100 pounds or more.
100 pounds?
Yes. The typical weight loss from a gastric bypass is between 90 to 120 pounds.
Whew. But there are some other types too, aren't there?
There are. A sleeve surgery can usually take off anywhere from 60 to 90 pounds. And bands can take off anywhere from 30 to 60 pounds. These are kind of broad ranges for the average person. But the point I'm making is that a person who has the surgery will lose all that weight usually within the first year. And once the weight is off, it's back up to that person to keep it off. So that's why I say it's a second chance. It's a second chance to get weight off and then to have a healthy lifestyle to keep it off.
Okay.
But if people don't change their lifestyle and continue to eat the same kind of food and refuse to exercise, then they will get the same result that they got the first time around with the first chance.
So they can gain it back?
They can gain it back. Now, they usually don't gain all of it back and go back to how heavy they used to be, because the stomach is so small, they'll never be able to eat as much food as they could before the surgery. But people can get around that by kind of snacking or grazing and kind of munching and nibbling on food or sugary drinks all day long, getting extra calories, and that can slowly put some weight back on. So when a person has the surgery like this, they have to change the lifestyle in order to get the most out of it.
And you offer counseling with that, don't you? Or do all the doctors do that?
Well, yes, we do. We have a support group in our office, and it meets once every month, and patients can get together and talk about what their issues are and how they're coping with the surgery, and share their success stories, and ask for help and guidance if they need a little extra encouragement. And we also have a nutritionist in our office who meets with patients regularly and goes over food logs to make sure that they're eating properly and getting the most out of their surgery. And then, of course, as the surgeons, we also meet with the patients regularly as well.
So what does a typical diet look like for a person that has already undergone weight loss surgery?
Okay, well,
I don't think I want to hear this part.
You might not want to hear it, okay? Most people think that they should be eating around 2,000 calories a day. Okay. But really, for my patients, I want all of them eating 1,000 or less.
That's not very much.
It's not very much, you're right. But when you have a stomach that's about the size of an egg,
also, you don't need that much.
You're not as hungry.
Okay.
So you can eat very small portions without being hungry. So it's a little bit easier to eat 1,000 calories in a day without missing all of those extra calories.
I don't know if I'm convinced, Dr. Lowe.
Okay.
I mean, if the person is used to eating 2,000 calories and then you drop it down to 1,000, will they have any energy to function?
Yes, they will. Yes, they will. The reason is because we really are overfed in our country.
Oh.
You know, our eye has grown so accustomed to supersize and large portions that we have at a restaurant, but we typically are getting twice or sometimes 3 times as many calories as what we really need to function.
So what happens to a person that's a food addict? I've heard that some people are.
Yes, there are some people who are food addicts, and I started doing these weight loss surgeries in 2004, and over the years of doing this, 9 years of doing this surgery, I've come to realize that there are some people who are addicted to food. And there are resources here in town available for people. One of my favorite is Food Addicts in Recovery Anonymous. And it's a group that operates a 12-step program, very similar to Alcoholics Anonymous. It's totally free. They have locations all over the city, and they have a meeting somewhere in the city every single day. And each location meets weekly. And like I said, it's a 12-step program that runs a lot like a lot like Alcoholics Anonymous or Narcotics Anonymous. And the other cool thing about it is each person gets a sponsor, so there's someone they can talk to each day if they feel that urge to eat something that they really don't want to eat or really shouldn't eat.
So tell me, once you have the surgery, are there some foods that are just off limits?
Well, I won't say off limits, but there are certainly some foods that are highly, highly discouraged, okay?
That sounds like off
limits. Right. Well, that's fair. You know, I really strongly discourage my patients from having cookies and cakes and sugary drinks and high-calorie foods like that, and fatty foods that are fried and greasy and oily, because that's just adding.
So what's left?
There's still plenty of foods left. There's still plenty of fruits and vegetables and lean cuts of meat, chicken breast and fish, nuts, whole grains. There's still plenty of food that you can eat that doesn't pack all the calories.
I'm still thinking about
Right.
this. I just don't know.
And you don't have to take all those vegetables and fry them either, like we do here in the South. And you don't have to take all those vegetables and put fat back in all of them either. They taste just as good without that.
But here in the South, we're accustomed to eating fried foods and heavy foods. And just the United States, there's a fast food restaurant on every other corner.
Yes.
So how do people that have undergone the surgery manage to eat a healthy food without being tempted?
First of all, you have to make up in your mind that you want to do that. Because until you have made up in your mind that you really want to make a change, then you're not going to. So a person who has this surgery has to make up in his or her mind that they want to make a change. And then you have to plan ahead. You have to recognize that tomorrow I'm going to be running here, there, and everywhere, and I won't have time to stop and eat healthy food, so I need to pack my lunch today. Otherwise, you'll succumb and have to go down to the vending machine or drive through a fast food restaurant because you haven't planned for the day. So basically what I want people to do is to be very conscientious about everything that they put in their mouth, and that starts really the day before by early planning. And if people can do that, they can really stay out of trouble.
You know, we're going to take a short break, and I have some more questions for you, okay?
Okay.
When some people struggle with their mortgage payments, they become frozen, petrified. Not knowing what to do, they do nothing. But the people who do something, the people who take action, are far more likely to get the most positive outcome. Making home affordable is a free government program. Call now to talk one-on-one with a housing expert about the options that are right for you. Real help, real answers, right now.
Oh, those boys are much too much. Those boys are much too much. We got the spirit. We're hot. We can't be stopped. We got the spirit. We're hot. We can't be stopped. We're gonna beat them and bust them.
The smallest moments can have the biggest impact on a child's life.
Let's get a little bit rowdy. R-O-W-D-Y.
Take time to be a dad today. Call or visit fatherhood.gov to learn more.
Hi, welcome back to Better. I'm your host, Cynthia Thompson. I'm here with Dr. Lowe, and he is explaining to me and educating me about weight loss surgery. There's a lot of things that I did not know, but Dr. Lowe, I'm sure with any surgery that there are some risks and some dangers. What are some of the common risks of these types of surgeries?
Okay, there are risks involved with the surgery. The two biggest risks that we worry about are blood clots in the legs, and that can happen with anyone who has any kind of general anesthetic. What happens is that when you're perfectly asleep on an operating room table, blood can have a tendency to pool in the legs, and if that happens, it can clot. If a clot in the leg forms, it can flick off and go to the lung, and that can cause shortness of breath, and it can be life-threatening. So there are several things that we do, recognizing that that's a potential complication. There are several things that we do to try to keep that from happening. Number one, everyone gets blood thinners. They get blood thinner shots to keep the blood thin so the blood won't have that tendency to clot. And then we put squeezers on everyone's legs, and that gives a constant massage during the operation so that the circulation continues to flow in the legs and the blood won't have a tendency to clot. And the third thing that we do is we insist that everyone gets up and starts walking right after surgery to keep those legs moving so the blood won't have that tendency to clot like that.
So that's the reason why they want you to get up, not to get up to leave.
Yeah, no, that's
to
right.
Get up and walk
to
around.
get up to walk around, exactly. They're not trying to just push you out of the hospital. They want you to get up and walk around so that you can not get that big complication that we worry about. So blood clot is not unique to bariatric surgery, but there are several risk factors that can predispose someone to getting a blood clot. Those risk factors are older age, smoking cigarettes, cancer, and obesity. So by nature, every patient that we operate on for weight loss surgery has at least that very last risk factor. So that's the reason why we're so sensitive to that, that particular complication, but it's not unique to this surgery. Any surgery can cause that complication. The other one I mentioned is leakage. When we do some of these surgeries like the sleeve gastrectomy or the gastric bypass, we're creating connections between two pieces of bowel, or we're stapling off a piece of bowel. And we can talk about that later.
You're
if you'd
going
like.
to come back for that.
Okay, all right, okay. But there can be a disruption in that staple line where it pulls apart. And if that happens, the food that should be inside of the intestine can leak out into the body, and that can cause infection. We don't want that to happen, so we test for leakage usually inside the operating room to make sure that before a person even leaves the operating room, that everything is secure and tight and not leaking. And I can tell you that the test that we do, if you're interested in it, it's pretty cool. It won't gross you out.
Let's save that for our next show because you've got to come back.
Okay.
We have more to talk about with this weight loss surgery.
Okay.
But I want to ask you one last question before we even close, Dr. Lowe. Why did you decide to start doing this type of surgery?
Okay, I'll answer that. Let me just go back one quick second about the risk before we leave that.
You're trying to scare me.
Okay. The risk that I talked about, the two biggies that we worry about, the chance of that happening is less than a fraction of a percent.
Oh, okay.
Less than a fraction of 1%. Because of all the precautions that we take, it's highly, highly unusual that that kind of thing happens anymore. And so I just wanted to mention that. Now, why do I do weight loss surgery? When I first came to Charlotte and joined my group, Carolina Surgical, my partner, Michael Melkonian, Dr. Melkonian, was doing these surgeries. And he had outstanding outcomes. People were losing weight, they were getting rid of their diabetes, coming off of high blood pressure medications. They felt alive again, they felt healthier again, they had more energy. And I was assisting him doing these surgeries, and I saw how wonderfully people were doing. And I asked Dr. Malconian if he would teach me how to do that, because I wanted to be a part of changing people's lives like that also. And he taught me how to do it. That was 9 years ago, and ever since then the two of us at Carolina Surgical have been helping people lose weight and reclaim their lives here in Charlotte.
You know, I think that's a wonderful thing that you're doing, and I'm so glad you came here. You did answer some of my questions, but I'm not totally convinced this is for me yet.
Fair enough.
But I do want you to come back and talk more about the lap band surgery, the sleeve, and the bypass, because I don't know anything about any of those.
I'll be happy to.
And I want to thank each and every one of you for joining me here at A Better You on Public Access 21 every Wednesday night at 6 p.m.